Yes, I'm confident that we can. We now possess effective tools for preventing HIV, so the challenges are not medical, rather they are social and psychological. There is no known vaccine or cure for HIV/AIDS. However, since the introduction of effective antiretroviral therapy in 1996, HIV has gone from being an invariably terminal condition to a manageable chronic condition. Well, unfortunately, it's not quite as simple as that, because in order for an HIV patient to access antiretroviral therapy, they need to have been tested and diagnosed first. So HIV testing really is a key step in HIV prevention. It's important both for health outcomes for the individual, but also for prevention. So it's important to know and to accept your HIV status. And this is the point at which social and psychological factors come into play. Although anybody can be infected with HIV, it does appear to be the case that some groups are at disproportionately high risk. Many of these groups are minority groups: sexual, gender, and ethnic minorities. In Western industrialized societies like Finland and the UK, men who have sex with men, also referred to as MSM, are at particularly high risk of HIV. We've also found that ethnic minority individuals face a higher HIV incidence than ethnic majority individuals. One study indicates that black MSM are up to 6 times more likely to live with undiagnosed HIV than MSM of other ethnic backgrounds. There are, for example, low levels of HIV knowledge and awareness in South Asian communities, where discussions around sex, sexual orientation, and HIV may be considered taboo and therefore avoided. And in cultures in which homosexuality may be forbidden or perhaps viewed as a sin, some MSM may not actually identify as being gay. They may not see themselves as being at risk of HIV, and therefore they may not get tested. Individuals from these communities may have incorrect knowledge about HIV. They are less likely to be open about their sexual identity, and therefore they may not have access to the HIV prevention messages that they would usually find in gay contexts, or that they might encounter through conversations with other gay men. A key finding from my research is that there is a relationship between social stresses and HIV risk. By social stresses, I mean those behaviors, events, and situations that can increase psychological stress. People try to protect their self-esteem in the face of social stigma. Both social stigma and sometimes the attempts to counteract it can lead to poor mental health. People may deny their reality, they may misuse substances, and they may engage in unprotected sex. Psychological well-being appears to be at the heart of effective HIV prevention, so it's vital that we pay more attention to the social and psychological lives of patients. To do this, we need to reduce social stigma around HIV. My research has shown that stigma can be effectively reduced when we raise awareness, when we challenge erroneous beliefs, and when we actually talk about things that we would, as a society, rather avoid. The message that HIV patients who are on effective antiretroviral therapy and who have an undetectable viral load cannot transmit HIV to their sexual partners is an important one. It's a message that can also contribute to stigma reduction. If we are successful in our attempts to reduce stigma, I believe people will test for HIV more frequently, they will feel more comfortable disclosing their status to others, and they will engage with HIV care. All of these things can prevent onward transmission of HIV. Minority research is one of Åbo Akademi University's 4 strategic research areas. The other 3 are drug development diagnostics, the C, and molecular process and material technology.